This is Amanda.
And Claire.
And Abby.
And Danny, and we did the von Willebrand disease. To start off, we looked into the primary blood component, and it occurs as a result of a faulty gene that causes problem with the protein. And this protein is extremely important to the blood clotting process, and it causes a decrease in plasma levels, and it causes a defect in the von Willebrand factor, which is a large multimeric glycoprotein.
So what is it? This disease is a lifelong disorder that causes blood to clot inefficiently and results in heavy, uncontrollable bleeding. There are 3 types which will be discussed in the next slide. But to summarize, type 1 is mild and common, type 2 is complex, and type 3 is the most rare and the most serious. Symptoms of the von Willebrand disease include abnormal bleeding, prolonged nosebleeds, heavy and long menstrual bleeding, and easy bruising. Causes are mutations of the von Willebrand factor gene, which Danny described. It's a genetic disease determined by the combination of genes for the trait. When one has low levels of the von Willebrand factor protein, platelets don't stick or attach to normal blood vessels during injury, like people with the von Willebrand factor. This results in a lack of clotting and excessive bleeding. Who's affected? Well, all people with a family history of the disease are affected, but women usually know before men because of apparent symptoms like having their menstrual cycle and all. But men and women have the disease equally. So these pictures explain the types. So type 1, as it says, is the most common, and it's dominant. It reduced quantity of the von Willebrand factor, but it's not absent, so they have some of that protein. Type 2 is abnormal, and it's also dominant, but it has 4 subtypes. Type 3 is the most severe and very rare, as shown in that ratio, and this is recessive. They have no they have no von Willebrand factor proteins, and that's about it.
So another way to describe how it is acquired, we have visual representation. So here it shows 2 parents, and then one has the dominant gene, or they both have one dominant and they both have the recessive. And it shows the different combinations of what they can possibly give their children. So it's caused by genetics, obviously, and this disease is a cause of a recessive gene. And as you can see, the 4th child, the one in red, is the one that is affected, and that's a 1 in 4 chance because he received both the recessive genes.
Okay, so what is it and the treatments that are provided for this? So as it says, there's no cure, but there are treatments that help prevent or stop bleeding, such as desmopressin, replacement therapies, contraceptives, clot stabilizing medications, and drugs applied to the cut. Desmopressin is a hormone that is injected or inhaled, and it causes your body to produce more of the von Willebrand factor proteins. This is usually utilized for type 1 and type 2. Replacement therapies are infusions of concentrated blood clotting factors containing the protein and can be helpful to all types of the disease, so all 3 of the types. Contraceptives are helpful only to women to help control heavy bleeding during their menstrual period. Also, the estrogen in the birth control pill can help increase the amount of blood clotting proteins in the body. Clot stabilizing medications. Meds like Amicar and tranexamic, I don't know how to say that, helps stop bleeding by slowing down the flow of breakdown of blood clots. They're not used to treat disease every day, but usually after surgery. So these ones aren't things that you would use daily to help this disease. It's just sometimes if you're going to the doctor and all. Drugs applied to the cuts. There's a fibrin sealant which acts as a glue to stop the bleeding. And the risk of this disease is it's genetic, so passing it through birth and other issues like anemia, pain, and swelling, and rarely death from bleeding out. So you just have to kind of be aware if you have it in case you want to reproduce and all that.
So there are an abundance of clinical trials that are trying to get closer to a possible cure. These can be found by searching clinicaltrials.gov, and all studies receiving U.S. government funding and also private funding are posted on this government website. But more specifically, the National Hemophilia Foundation is the leading, largest, and only national nonprofit organization dedicated to finding better treatments and cures for inheritable bleeding disorders and to preventing the complications of these disorders through education, advocacy, and research. Established in 1948, the NHF has chapters throughout the country. Its programs are made possible through the generosity of individuals, corporations, foundations, and the CDC. Current research suggests that many cases of heavy menstrual bleeding might be due to an underlying bleeding disorder, the most common of which is VWD. A 2002 CDC study of obstetricians and gynecologists in Georgia found that only 4% of the doctors who responded would have considered VWD as a possible cause of heavy menstrual bleeding. Some more stats are that 1% of women in the U.S. have it and don't know it, 17 to 37% of women with heavy menstrual bleeding have it, and it is equal among men and women, but women feel more symptoms. It affects 1% of the population. So these are just some visuals that I found from several different nonprofit agencies for VWD. So from NORD, this graph shows the functional impairment of VWD. And from the CDC on the right, this shows that it is a Centers for Disease Control and Prevention.
So this is our public service announcement. It is about the Red Tie Challenge, and it's a movement created to start a conversation about inheritable bleeding disorders. So the challenge encourages individuals to show support for their community by recording a short video that shows them wearing a red tie, which is kind of like the one you're going to see here. It also encourages their fans to take the challenge. They can also post a video to their social media with the hashtag Red Tie Challenge to just kind of get people involved and get people informed about it. And then, of course, people can also consider making a donation to support the bleeding disorder community by going to theredtiechallenge.org. So here's our video. So we hope that video caused or brought awareness to you guys, and now we're gonna talk about our tweet. So we tweeted an organization and we asked them, what are the financial obligations to those affected by this disease and how important is the support system to these individuals? And of course we tagged Chevalier and hashtag OP Blood. I don't know what that even says. But anyways, thanks for watching.
This is Danny.
This is Abby.
And Claire.
And Amanda signing out.